Again, my name is Eric Auger with American Business Systems. I want to welcome you here this afternoon as we talk about is 2021 your year to launch a business of any sort, whether it's in medical billing or any type of business, is 2021 your year to do that. Again, my name is Eric Auger. I'll be one of your hosts this afternoon, and I'm looking forward to introduce you to my co-host, which will be Patrick Phillips. First of all, let me tell you a little bit about American Business Systems. It's been around for over 27 years. What makes ABS what it does is the platform, the medical billing platform as you're looking at it, the iClaim and the EMRX platform. It's all web-based. There's nothing you have to load on your computer. So just think about that. You don't have to load CDs or DVDs or download some software onto your computer. This is a truly web-based system where you just go into a URL and go directly to the site there for iClaim and EMRX, type in that information in, type in your username and password, and you're into the system. So just think about that, because there's nothing you have to update or upgrade or make sure you have the right patches on your computer or not. And that's what really makes everything, as you can see here, a complete system. We've got iClaim, EMRX, which is the electronic medical records platform, the Clearinghouse, and then the patient portal, as you can see right there. We've got folks, licensees from coast to coast, all walks of life, all different nationalities, all different age groups too. So there is nothing that should hold you back here from joining us here at American Business Systems. There are 9+ service lines that you can utilize here at American Business Systems, as you see here. And then Patrick and I will go through some of these this afternoon, just for each of you if you haven't been able to go through these yet. Let me introduce you to my co-host this afternoon. He is also the founder of American Business Systems, and he will be joining me this afternoon, really joining you and helping you answer all your questions. So again, if I could get a few more folks over there besides just Trudy to type in something over there in the question box, I'll really know that I'm being heard here. So let's see if we can't make sure that that's being done there. So let's make sure that let me get over here to my attendees here, call out some names. Maybe Angela, maybe you could pop in and say something over there in the question box. But as I'm waiting on that, Patrick has written several books. He has written the New Thriving Medical Practice, as you'll see that. We'll talk a little bit about that this afternoon. How to Reprogram Yourself for Success, and Cash Crunch to Cash Flow. Oh, thank you, Nuri. You are listening. Thank you. I appreciate that. He's also an editor on the editorial board of the Billing and Coding magazine that comes out bi-monthly there. And he is also the co-founder of the Medical Revenue Managers Association of America. So without any further ado, Patrick, it'll be great to have you on here this afternoon. There you are.
Hey. Hi. Well, we got some reluctant folks on here, a little shy, aren't they? No, there's some more. I see Angela. She just typed in.
All right, good. Yeah, okay. Angela says, I'm hearing you loud and clear, so thank you so much. Patrick, why don't you pull one of those books off the shelf back over there, and why don't you read us a little bedtime story?
Who, me?
Yeah, pull one of those books behind you, and just why don't you read us a little story?
Yeah, I'll just reach back here to this invisible. Oh, technology's great, isn't it?
It is. It is.
Anywhere I want to in the world, and actually, I could be sitting in, my bathroom. Nobody would know it, right? I mean, I could
Nobody
be just...
would know that. That's for sure. I don't know if anybody would want to know that.
No, that's not something they need to know. Well, Eric, this is an exciting topic because people don't realize that, there are a lot of businesses that thrive during hard economic times, shall we put it that way? That's kind of what we're going through, I guess. And I don't know about you, but of course we live in Texas, so everything here looks brand new. It's like you go out and it's just like we're back to normal. It's just amazing. And so I'm hoping that we are on our way all over the United States to get out of this lockdown that we've been in. And I thought I would show a picture of me and my family back in that's my wife, Linda. People ask about her all the time, and I say, well, she's just retired, very nicely taken care of lady, and we've been married for 53 years coming up in August, Eric.
That's
Hard
amazing.
to believe, huh? I know. You look at
That's
me and you go,
amazing.
well, you look like
You're
you could
both of
be
you are
married for
looking how
53 years.
good you look.
And there we are, more recently at least. You can see my hair at least has turned gray there in that picture. And sitting there in my office. Well, anyway, the point is that we started that business back in 1987. I think she started doing medical billing. And then by about in the 90s, the early 90s, we decided that people were asking us how we got this business started. How did we make money working from home in our pajamas, doing billing for doctors? That's what we're talking about today, folks. And we're going to show you exactly how we did that step by step and decide whether this is the right year for you to do that.
Absolutely. So yeah, that's what we're going to start off with this afternoon, folks. So we're going to look at, is 2021 the year for you to be able to start your business in really any type of business, whether it's medical billing or any other type of business here. So because like you said, whether it's during a crisis as we've had over in 2020 or any other crisis that, Patrick, we've been around long enough to see things kind of come and go. From an economic standpoint, we've seen people survive that and actually get very far along in billing in the medical billing world.
Yes, and there's a great quote here you've got, Eric, from Techstar director David Cohen. He says 8% of all entrepreneurs are in healthcare. That's how big this industry is. All kinds of aspects of healthcare, of course, but then he says healthcare has become an especially fertile area for founders this year. So I'm the founder of American Business Systems, but I founded the company 27 years ago. Now you guys have the ability to found your own medical revenue management business with our help. We'll teach you exactly how to do that step by step if you go through our virtual training, online training. And as he says, this is the right time for people to get started. He says we've had to do healthcare online, and that has broken down resistance to the new tech-centered ways of addressing medical needs.
Absolutely.
So I think the what is, I guess you call it, telehealth with doctors being able to talk to them virtually. That's just almost becoming normal now for most people.
Very much normal. Yeah, and I think even the population has even found that to be very, very good and very easy to start working with. And it's just becoming an adopted thing.
Yeah.
Yep. And then we've got this other one about from BlackRock, where it's really talking about how well things are growing even in the home market already.
Yeah, this is an investment reviewing company, as you can see from the headings there. And this talks about the fact that we like tech and healthcare due to the pandemic's transformative shifts.
Correct.
So you see, even investors have realized that this is the right time for people to get involved in the healthcare industry, because whenever there's big change, Eric, as you say, there's always big opportunity.
Big change leads certainly to big change, big opportunities. And then Black Book Rankings says that even physicians are looking to do something differently with their billing and collections, as high as 89%.
Yeah, they all agree that their billing and collection systems need upgrading. So, Eric, that's good news for us, because we can walk in, our licensees can, once they've gone through our training, have got their business up and established. We're going to teach them how to make connections with the doctors in their area. We know exactly how to do that after 27 years. And we'll tell you how to make those connections. And those doctors are all wanting to upgrade what they have. They have old software. It's all server-based usually. It's not cloud-based like ours. And they want something that's high-tech, easy to access from any computer or any device anywhere in the world. And we've got it.
Now, Patrick, before we get real deep into the webinar, why don't you go ahead and introduce Dr. Vicki Rackner, how she works with us here at American Business Systems, and then tell us a little bit about this book, The Myth of the Rich Doctor. Very interesting title.
Yeah, I'll go into a little bit more detail with Dr. Vicki just a little bit later in the webinar, but this is one of her latest books. And as you can see, she says physicians in private practice walk away from an average of 30% of their incomes when they do not follow up on rejected insurance claims. In other words, those claims are processed in their office, usually by their staff. They're sent into the insurance companies, and those insurance companies, for many, many reasons, can reject those claims, send them back, and tell them, you got to correct some things on here for us to be able to pay this. 30%, and Eric, a lot of those never get resubmitted. Those people are way too busy in the doctor's offices. There's another 20 or 30 claims today. They don't have time to look at the claims that were rejected from yesterday. And so that's why we can come in and bring the rejected rates down to as low as 2 to 5%. In fact, nationwide, ours is at 2% rejection rate.
Well, I mean,
so
this quote right here,
fastest and easiest way to increase your cash flow. She's talking to doctors there. This book is meant for doctors, of course.
Absolutely. But if I am looking to get into the business of medical billing, that's a great book though to read, and you can go find that. And we're not trying to sell you a book or anything, but if you'd like to, before you invest, maybe a lot of money into your business, go check out some of these books. You can actually find that book on Amazon.com and get that book, and so you can follow along and see what kind of get the inside scoop from a doctor there.
Yes.
Go ahead, Patrick.
Well, and this is a great quote too here from the Academy of Professional Coders. They found that the average number of rejected claims for medical practice averages around 34%. Now you'll hear different numbers. Dr. Vicki used 30. That was just a rounding number there. 34, that's even more. And there's others. The next slide here. Yeah, that's not unusual to have 35% or higher claim rejection rate. So we didn't just pick this number out of the blue, folks. This is a real number. Imagine as a business owner, 35% of your receivables you never collect on those, because like I said, a lot of those claims never get resubmitted.
And folks, the reason we're showing this to you is we've got to help you understand that doctors are in a pinch. And Patrick, I think a lot of people were thinking, well, don't doctors have their own biller that works in their office and a whole staff of people that does billing? Why would a doctor, why don't you just take a few minutes here, why would a doctor ever want to step outside having someone in their office do the billing?
I tell people it's real simple. Number one, they don't want to do the billing in their own office. It's a hassle. It takes away from them paying attention to the patients that they should be helping the doctor see more easily and more on time and so forth. And they can save a lot of money by outsourcing it. Now, a lot of doctors have already decided that that's what they should do, and they've already outsourced. About half that we figure in the United States have outsourced their billing. But our licensees sign up those doctors left and right, because when we come in and show them the superiority of our technology and the way our whole system is integrated, they fall in love with it, and they realize they're probably still leaving a lot of money on the table. Exactly. So we have a market no matter what.
Absolutely. And I know that probably the question is going to come in, but there's 50%, what happens with the other 50%? Well, you're going to find out in this business that doctors kind of move in and out of this. They feel like if they can have it in-house, then that's good, but if they outsource it, it becomes better. And then they may not find the right solution there, so they bring it back in-house, and then they may say, you know what, I'm losing more money in-house than I ever did outsourcing. So you may find a doctor kind of on that rebound and being able to find, that you're going to be able to help that doctor. Because we're going to go over 4 major areas of what's going to help you kind of get kicked off on the right foot, helping you answer the question, is 2021 your year to start a business? And so the first thing that we're going to be talking about is some of the things we've already been talking about, that doctors are in pain. I think Dr. Vicki Rackner says that quite often, Patrick.
Yes, in fact, she says that the doctor's pain is your opportunity. Yeah. Meaning there are doctors out there that are in pain. They need help with their receivables, and they're not collecting as much money as they could be collecting for the work they do. Why not say, hey, I could help you with that? And in fact, it'll cost you less than it does to hire your own staff and keep your own people inside your own office there doing it.
That's correct. The second thing we're going to talk to you about is that the doctors need a remedy. Obviously, if they're in pain, they need a remedy. We also are going to show you in today's webinar how you can become the solution, and then you need a support team. So we're going to tap onto those four areas this afternoon, see if we can't help guide you at helping you answer that question about, is this your year to actually get started in the business of medical billing? Well, first of all, Patrick, we said the number one reason, obviously, doctors are in pain. Well, you know, if we talk about anything, why does anybody buy or get a service? Why would I hire a roofer? Well, I hire a roofer because I got damage on my roof. If I need to call a plumber, I'm probably calling him not just because I want a plumber just to show up at my house. I've got water running throughout my house. So there are reasons why we hire people to do things that we cannot do. And billing is one of those areas that the doctors just are not that great at doing.
Well, they're not trained to do it. Usually the person who's doing the billing was just trained by the person that was there before them. It's not like they're experts or they have degrees or certifications in billing. Most of them just took it on because that was one of the tasks that the doctor said that they should work on inside the office. With our people, of course, they're billing for several doctors, not just one, but
Right.
a bunch of clients. And so they have this experience base that gives them the advantages of pulling in the money faster and more of it. And look, here's some of the pains that doctors have. We took this from a survey from the Medscape Lifestyle Report. You'll see there at the bottom. And look, one of the first things that it says, what are doctors concerned with, is too many bureaucratic tasks.
Correct.
Well, that includes the billing.
Yes.
And the reason they spend too many hours at work is because they have to do all that plus oversee what's going on with the billing, or they could be leaving money on the table. Some of them feel like a cog in a wheel. I mean, look at all these things. The increasing computerization of the practice billing. See, they don't want to learn anything new. Doctors don't want to get into electronic health records, but they have to because the government is telling them that they must in order to be paid. And then next there, of course, income is not high enough. People think doctors are wealthy. That's why Dr. Vicky wrote that book, The Myth of the Rich Doctor.
Right.
They're not near as rich as they thought they were going to be when they read about becoming a doctor, you know. So,
Well, they're not as rich as most people think. Now, they may live a certain lifestyle, but Patrick, you and I have heard time and time again where there are some doctors are so behind on getting those claims processed properly, is that some doctors are having to take loans out just to cover payroll. When you reach that point, you're in some serious trouble. So what we're showing you is that you can actually help those doctors prior to that and kind of get them caught back up on what they need really some real help with.
Yeah, in fact, look at this quote from the New England Journal of Medicine. That's pretty solid documentation there. Market analysts estimate that 24 cents out of every dollar are wasted on the administration and billing expenses. So there's proof right there, folks, that doctors are spending 24% of their revenue. Right. Imagine that, just on getting the billing done. That's ridiculous. No business can maintain that and stay in business and make the kind of money they should be making. We can bring that down, our licensees, to as little as 6%.
And you know what, folks? A lot of people think, why do it? Well, don't doctors already have their own billers? This is a great time to talk about that, because this is basically what it's really costing a doctor to do billing in-house. We've got a whole spreadsheet that you would be able to walk a doctor through to find out where all the money is actually going just to do the billing. Everything from the payroll for that employee, to the payroll taxes, to the software fees, and then we add in the claims that are not getting paid. It all adds up, and it adds up pretty quickly. So when Patrick says that you can help that doctor get their billing done as low as 6, 7, maybe even as high as 8%, that's still a bargain whenever you can see why outsourcing medical billing is the right thing for the doctor to do. So just keep that in mind as we kind of go through this.
Yeah, look at this from Physicians Practice. It's an online site that's really popular with doctors. Look at the headline: economic pressures bolster the case for outsourcing your billing. And look at the quote there to the right. The greater the economic pressure on a practice, the more viable outsourcing becomes. Outsourcing billing processes should ultimately reduce the cost of collections and maximize revenue, allowing for a practice to invest in clinical resources and get better quality results. In other words, they should focus on what they're good at, seeing patients and helping people get well, not the billing.
Absolutely. Folks, let me remind you that we're about 25 minutes into the webinar so far. So if there's any questions you'd like to ask Patrick and me, I know that we're kind of being on the technical medical side of the medical revenue side of this, but feel free, if there's a question that comes to your mind, feel free to go ahead and text us in the question box, and we will certainly take a look at that. Yeah. Patrick, we're talking also about how long it actually gets paid. I mean, time it gets for a doctor to get paid.
Sometimes it says typically 30 days, but that's if there are no denials. If there are denials, the doctor can expect payments as far out as 90 days, which most of them, dealing with most insurance companies, they're going to have some denials. So their claims can be tied up for 45 to 90 days, and that is ridiculous. Eric, again, no business can stay in business getting their money paid to them that's owed them in 90 days.
Absolutely.
So we can reduce that way down to as little as 7 days.
In 7 days. So imagine that, folks. So going from a 90-day payout to 7 days payout. So I don't know about you, but if I'm doing some work, I'd rather get paid a lot quicker. And that actually helps the doctor keep that cash flow going. That's their biggest reason. That's one of the reasons Patrick wrote the book, Cash Crunch to Cash Flow. That's what we're able to do. Talking about claims that are ended up denied, folks, this is from the American Academy of Professional Coders. They state on average 50% of denied claims are never resubmitted. So again, you take that number that just don't get paid, and then they never get resubmitted.
And even if they are submitted, unless the person resubmitting it knows what they're doing, it might be rejected again and again and again.
Yeah, absolutely. And so that is an incredibly big number. And imagine how you're able to really reduce the time it gets paid, but also help that doctor increase that revenue there.
We're asked all the time, Eric, what is it that makes you stand out? I know there's other medical billers out there doing billing for doctors, and so where do I fit into this? Well, folks, you become a part of our network. We're the nation's largest network of medical revenue managers. In other words, we have in place the network to support you if you do get into this business, because most people are scared, Eric, to get started on their own because they go, well, what if I have a question that I can't find the answer to? Who's there to support me? So we'll talk about that little support here in just a second, but it's very strong because of the fact that you become a part of this network.
Well, Angela is kind of talking about that, and thank you, Angela. You finally helped us break the ice on some questions here, but she's got a background in healthcare, and she's just stating that this is a big step, and it is a big step. Anytime you step out and start working for yourself is obviously a big step, whether it's in this field or any other field. Patrick, she's asking, what guarantees can you give me or give that I can be successful with ADS in New York, since this is my home state?
Oh, wow. We used to have that question asked a lot, Eric. You remember people would say, well, it's different up here in New York than it is in Texas and Florida and California. And then we started having so many success stories from our licensees who are up in that area. It just blew me away. I mean, literally, one of our biggest licensees is up there in that area and has over 100 doctors as clients. So, folks, it doesn't matter the area of the country that you're in. Believe me, there's always people who get sick. They go to the doctor. The doctor has to bill somebody to get paid, and somebody has to do that billing for the doctor. So this is one of those guaranteed businesses that is just like I tell people selling popsicles in the Sahara Desert, because you cannot go wrong if you're giving doctors what they want, which is more revenue.
Absolutely. And one of the other big questions that comes up, Patrick, from folks is, what about certifications? And do I need to become a certified coder or certified biller? Why don't you talk a little bit about what MIRMA, who MIRMA is, what they do, how they certify our licensees, and really how this credentialed part of this, or the certified part, actually helps our licensees go out there and market their business right off the bat.
Yes, you'll see that logo there in the bottom left-hand corner, folks. That's MIRMA, the Medical Revenue Management Association of America. That's a mouthful. .org, by the way, if you want to go check out their website and look at their advisory board, for example. If you want to see the type of people that are helping our licensees be successful and certifying them as they go through our training, you'll find it there on that website. Folks, this organization basically is behind all of the training that we do, which is all virtual, all online now, one-on-one with a real live person, an instructor. And the instructor is someone who has been in this business and has made a very successful run of it for at least 5 years. So you've got people who can teach you who are actually out there doing it themselves. And it's just a wonderful, wonderful way to get your business up and running.
You bet. Absolutely. Now, folks, we've just spent almost the whole first half hour on the first part of that, and that is the doctors are in pain, and then now we're going to move to doctors need a remedy. Now, what does that mean that the doctors themselves need a remedy? Well, just think of it. We go to the doctor, we don't feel well, and we're going to that doctor for help because we see that they can be a remedy. And that's what you become as a licensee here, or a medical billing business owner here with American Business Systems. And so it goes far beyond, Patrick, of just sales. I think probably the biggest thing that brings the most fear for brand new ABS business owners is that there's a fear of having to sell something.
Yes, that is the biggest fear. Most people are scared to death of the thought of selling something. And folks, here's what you have to look at it. We do this completely different. I mean, even starting with the practice analysis, this is a thing that we offer through you to the doctor's offices at no cost. It's a complete 3 or 4 or 5 page now, I think, questionnaire that asks them questions about what they're currently doing to handle the revenue in their office. You'd be surprised how involved that can be. We go through this in our training, word for word, question for question, tell you exactly what to expect and what the answers will be, because we know after 27 years what they're going to answer most of the time on most of these questions.
Right.
Then you don't do any selling, you leave. At that point, you close up your notebook and you say, well, I'm going to go run this through my software back at the office, and I'll bring you a report and show you what we can do for you. And here's the report. Eric has a picture of it right there on the screen. If you zoom in on that, Eric, you'll see that that is a report that you give to the doctor comparing what their current situation is. Remember, you get all those numbers from them. You plug them into this spreadsheet. It also shows down there what the projected increase in revenue might be. Look, in this case, that's is that $27,000 a month? Yes, for this particular doctor, and that's over $122,000 a year. Eric, if we could only do half that, wouldn't the doctor be silly not to at least give us a try?
Absolutely. Yeah, that's exactly correct. Whenever folks, think about this. If you're able to show a doctor that you're not just saving them money, what you're doing, you're adding more cash flow to that particular doctor's office. And again, as Patrick said, if you even were able to get a quarter or more of that into their practice, that alone can keep them from having to go to the bank again to get money sometimes just for payroll.
By the way, we'll go through this in detail, of course, with you in the training, but you'll notice that section there under projected, it says your monthly cost of outsourcing. You see that $2,000 right there? That's what you would be charging this doctor. Absolutely. To bring them another $27,000 a month. So it's a win-win for everybody.
Absolutely. And then you're going to be able to utilize all of these different services. Now, obviously, we're not going to have time in the next 25 minutes to step you through each one of these. We will touch on them just real briefly, but these are the remedies that the doctors absolutely need.
Yes, and Eric, since we do have slides for each one of those, why don't we just jump right over that? And we'll just say, folks, these are all optional. There's no additional cost for them. They're all included in your package. When you pay our license fee of $28,000, that's just like a franchise fee that covers everything. You never have to pay us another dime. Now, part of that, of course, is going to include some marketing tools that we've developed over the years. Here's a little flip chart that we have, for example, that you can use, or you can put it on your iPad and use it digitally to illustrate to the doctor exactly why they should outsource their billing to you. We give you exactly the script to use for this. In fact, we have a recording of somebody going through this so you can actually hear it for yourself. And that's just one of dozens of tools that we spent literally over $100,000 developing.
You bet. And I think one of the greatest tools for whether they are a new medical business owner with American Business Systems or one that's been around for quite some time. And that is basically what Patrick and I are doing right now. We're on live with you. We're doing a webinar. We're talking to you live and then answering your questions as they come through the webinar. Imagine that you are sitting at home or you're sitting at your home office and you've already been engaged with the doctor, and the doctor says, yes, hey, Patrick, let me see your software. We here at American Business Systems will actually demonstrate the software for you on your behalf to the doctor. So imagine that we are going to take the bulk of that load and make sure that we answer the doctor's questions, show them around the entire system, and then help you close that, what you think about kind of closing that deal.
Yeah, we close about half of all the demos that we do, so we must be doing something right. And folks, think about that. That takes all the pressure off of you answering any questions about our system. We're on there to answer the questions. You get to hear the question and the answers that we give. And eventually you'll probably be able to do that yourself and give your own demos. But the point is, we're willing to do that for you at no additional cost, as many of those as you need to get as many clients as you wish.
Absolutely. Now let's move on to number 3, that you actually become the solution. And this is where we're going to kind of get into a little bit more in depth on each of some of these solutions here that you can take advantage of being the solution for the doctor. Because what you've seen so far is, let's kind of break this down. Again, we're kind of about a halfway point anyway. We've got to know that there is a pain. We realize that the pain is the doctors are not getting all their money. They're losing money. They're losing money from just claims that are not being processed. And then if there's a problem, not being reprocessed. We're showing you that you, again, can be the remedy. Now we're going to show you how you are going to actually start bringing in, you already know that you can help them. What are your solutions now with that? And one of the biggest solutions here that we can see is, again, with Dr. Vicki Rackner. We've already talked about her, and then didn't you just do a webinar with her just here recently, Patrick?
Yes, that was was it last week or a week before? Anyway, yeah, Dr. Vicki, of course, has partnered with us, folks, to help you build your business. Now, one of the ways she's done that, as you can see, she's a prolific writer. She's been interviewed on lots of TV and radio programs. She's got lots of books out there on the internet, and she speaks in front of doctor groups on a regular basis. Here's some of her books right here. In fact, you'll notice that she's written one called The New Thriving Medical Practice with me as a co-author. Then she's written one there. Oh, sorry.
Sorry, I jumped ahead. No, you go ahead.
Right. The middle one there is how physicians can get more patients. Again, these are marketing tools that we've developed for you. So that's a PDF file, and you can also print those out to hand to a doctor. Then we're about to release one here pretty quick called how 9 Ways Physicians in Private Practice Let Money Slip Through Their Fingers, but we're revealing too much already.
Well, here's what you know, whenever it comes to doctors, folks, that doctors like to hear from other doctors. And one of the brilliant things that ABS has done I might as well go ahead and say it. What Patrick did is to find somebody like Dr. Vicki Rackner to be a support mechanism for you. Now, you can already saw in some of the previous slides that we're already doing a lot of that solution work and showing you the remedy, that we're going to be doing some of the demos and being engaged with your doctor early on. But again, some doctors want to hear from other doctors, and that's why Dr. Vicki Rackner is a part of the ABS team and a part of you. Now, the great thing about it is some of you might already know this. Some of you, I have not seen your names before, so this is going to be maybe brand new for you. But imagine that you can partner with the doctor and with Patrick Phillips in the book called The New Thriving Medical Practice. Now, Patrick, tell them how that works for them.
Well, as a part of your license fee that you give us, of course, to get into the business and go through the training and have the support and so forth, and utilize all of our online technology, we have written a book that you can be a co-author of. Well, at least the forward to the book. And you'll see that we can put your name right on the front cover. It's on the title page. Your contact information is there at the end of the forward. Folks, this is a great marketing tool, and imagine the credibility it brings you to have your name on the cover with a medical doctor. Doctors respect other doctors. They listen to what they have to say. So when they see your name connected here to Dr. Vicki Rackner, it gives you great credibility you would not have otherwise. And these books, you get a supply of these books, of course, with your initial license fee. Then if you need others, you can reprint this at our printing cost, which is as little as $4 a copy. Yeah.
You know, Patrick, didn't you tell me not too long ago that one of the licensees actually was handing out the book? The doctors called the licensee back and says, "I love the book that you wrote."
Yes. Yeah, they assume that you're an author of the book just because your name's on the front cover, when actually all you did was write the forward. Now, we have the forward already written, if you're wondering, that you can just put your name on. It's very generic, or you can write your own, of course. That's what it's for, is to personalize it any way you want to.
You bet.
Let's show why this is read by the doctors, though, folks. We don't just hand a book to a doctor. In fact, the guy that you were just talking about, Eric, didn't hand them out. He mailed them during the COVID. He just dropped one in an envelope, addressed it to the doctor. He put on there private and confidential. And of course, when an office manager gets a package that has obviously something like a book in it, they're not going to open it. They just put it on the doctor's desk, right?
Right.
So when the doctor opens it, we've actually surprised them by marking with little tabs, as you see there, actual highlighted passages within the book. So every one of those, when you turn to it, has a highlighted passage that pulls them right in. It just sucks them right in, Eric, so they don't have to read the whole book. They will get out of it enough out of those 10 tabs there to make them want to call you back up and say, "Hey, I may need your help."
And folks, again, this is something that happens during your training, and we're going to talk to you a little bit about the training here just shortly. But imagine that you're in your living room or wherever you may be doing the training there online, and you've got the book. You're going to be highlighting those areas. So guess what? You're learning more about the industry. And then whenever the doctor calls you up and says, "Hey, you know, I was looking on that page 125 there, and man, this quote really jumped out at me," you'll already know all of that information to really start working with that particular doctor.
Yeah, it's all about positioning you as the expert, which you will be once you go through our training. We'll talk a little bit more about that here in a second. Hey, Eric, this is a great time, I guess, to tell them about the difference between regular billing software that, you know, comes on a CD that you put into your computer versus our cloud-based system.
Correct. Yeah, we'd mentioned to you earlier about CDs or DVDs that you used to load, and there are some software that is still like that. Matter of fact, if you want to call it comparison or a competitor of ours, that's the way that their software is still distributed, is through CDs and DVDs, and so you've got to manage all of that. That's part of what's going to be your job, is managing software and updates and like that. So typically that's what you see, is a billing software that gets loaded into a computer software system. So what that's going to have to do in most cases, it's going to make you really kind of find a computer that actually has CD player or a DVD player to load that software in. But then once you've got that, then when you process a claim out of one of these things, it's got to go to a third-party clearinghouse. Now, you can see that this clearinghouse really sits outside of the billing system. Now, the clearinghouse is a very key component in medical billing, because once you've created a claim, when you've got that information from the doctor and you're going to input it into a billing software, and it's going to convert all those codes and everything, once that's ready to be sent, so to say, it's actually being sent to a clearinghouse. Then that clearinghouse is going to scrub the claim. Now imagine that there's a problem with that claim. Remember earlier, Patrick and I mentioned to you that some claims get rejected. It's at this point that that claim would actually come back over here. Now that could take a day, 2 days, 3 days. And then if you're the billing manager at a doctor's office, all of a sudden you're seeing a lot of these claims get rejected because of the clearinghouse. You can see it never even gets to the insurance company. But again, typically from there, if it does pass the clearinghouse, then it's actually going to end up getting over to the insurance companies. That is a scenario that is become very archaic because our software is, number one, a cloud-based software as a service on the internet. And we've already got built inside of iClaim the clearinghouse. So that allows you, when you're doing the billing, that whenever that claim finally does leave the system here, it's not going to some other third-party clearinghouse. It's going directly to the insurance companies, allowing those claims to get paid quicker, 7 days, as Patrick said earlier, and then in a much shorter time. We're talking about less than 7 days with some of these claims getting paid.
And with less than a 2% rejected rate. And you put those two things together, folks, and that is the solution the doctor is looking for. More money, 2% rejected versus 30, and faster money. That's all they want.
So imagine that you find yourself as the solution, less than 2% rejected claims, getting paid within 7 to 10 days. That's on top of you doing that practice analysis earlier. So Patrick, I mean, if I'm showing you that I can actually get you more money into your pocket, and I'm actually going to be able to do that in a quicker time, again, why wouldn't a doctor talk with you? And that's why, again, what Patrick said earlier, when we actually demonstrate the software to you, that's why we're closing more than 50% of those doctors for you as a new medical billing client for you.
Yeah, if you haven't seen that demo, folks, you need to get back with the person who invited you to this webinar, that's your ABS rep, and just tell them, I want to see a live demo. I don't want you to sell me anything. I just want to see your demo of your new cloud-based software. And we'll take you through that, a half hour, 45 minutes, an hour, whatever it takes to answer all your questions about the software. That's the only way to really get a feel in real time what this software is all about. You'll be blown away, just as the doctors are.
Well, let's take a look at the last thing today. Number 4, you need a support system yourself, a major support team. And really, Patrick, part of what they're getting here at American Business Systems, maybe you want to talk about that right now before we even get into number 4, that the agreement that they have with American Business System is training and support. Why don't you kind of talk about that, share how that really works and how that actually becomes very successful for them.
Yeah, that's a good point, Eric. A lot of people think we're in medical billing ourselves. There are competitors of ours that are out there selling this type of training and software to people, marketing ideas and so forth, and they're in the billing business themselves. That doesn't make any sense to me from a business standpoint. I don't want you to be my competitor. You know, a franchisee should be the franchisee of that business, and that's all. They don't need the home office competing against them. Now, if you're a Burger King, sure, if there's another Burger King 5 miles away, that wouldn't affect your business. But with ours, folks, you can sign up doctors anywhere in the United States, and we have licensees that have doctors literally from coast to coast that they've never met, because with referrals, It's just done online through our system. There's no traveling or having to visit somebody. You might do a Zoom meeting with them at the most to get to know them. But all of this to say, we're not in competition with you, and you shouldn't be in competition with the people who are training and supporting you. And that's all we do, is just support people. That previous slide, I think, Eric, is the one. Yeah, that's one of our offices out in California. As you can see, folks, we have literally dozens of people that are able to support our licensees because we have technology partners from coast to coast. We've got some in Florida, we've got some in New York, we've got some in California. And these are people who want to help our licensees because, well, they make money off of all the services they offer to the doctors too, just like we do.
And talk to us about the licensee support site, because that's a big website there.
Yeah, folks, you can't actually get into this website, of course, unless you're one of our licensees or business owners, we call them, because you have to have a login, a password and ID. But just trust me, when you go through the training, you'll be given access to parts of this at the beginning that will show you the wealth of material that's out there. Eric, we've had that out there since 2014. There are ongoing training and motivation webinars that are done on a regular basis. We post all of those out there as recordings. These are all done live, by the way, by our staff and visitors and guests that we have that do these webinars for our licensees. Again, folks, there's no charge for any of this. This is ongoing education and training, all a part of your license fee.
And for an example, I noticed that we've been talking about Dr. Rackner, but we're doing a webinar for our licensees this coming Friday, just 2 days from now. And so we've got Dr. Rackner going to be doing a webinar on cultivating a culture of introductions with Dr. Vicki Rackner. And so here's going to be a one-on-one with a doctor, and she's going to talk to you how to cultivate introductions to get in front of those doctors.
Yeah, this is her specialty, folks. She is an expert, has been for the last 10 years. She's been helping other business people who want to connect with doctors. How do you get in front of a doctor? What do you say to build credibility with a doctor? And she has all kinds of tools that she's brought to the table for our licensees exclusively to help you get in front of the doctors and get your first client. So this is one of the webinars that she's doing here, coming up Friday. That's right.
That's amazing. And folks, again, we've already mentioned to you that we're doing these live demos for you, for your doctors. So again, as Patrick said, if you haven't seen a demonstration of our software already, again, get back with the person that invited you to the webinar. Patrick, now is when we're going to kind of step through some of these other solutions here. And obviously, because of a pandemic, our licensees needed a solution in telehealth.
Yes, it was driven by all this social distancing, and we thought, well, why don't we just figure out a way to help them to connect with doctors without having to go into the office. Now, this is being done pretty normally now amongst doctors, but there's still a lot of doctors who are scared of it. They don't understand the technology, they don't know how to do it, and they don't have a HIPAA compliant way of doing it. This is one of the services that you can offer to doctors, again, at a fee. You make money on this, of course, and so do we. We make a few pennies on each transaction that our licensees sell to the doctors, but it allows them to have video conferences with their patients. And of course, we're going into much, much more than that, Eric, aren't we, in the patient monitoring stuff?
Absolutely. Yep, you bet. Now, Patrick, I know a lot of people are still afraid of coding, medical coding. I want you express about the solution about CodeWrite and AuditGuard.
Yeah, people think that they have to go through some kind of coding class at a college or online. Folks, you don't have to be a certified medical coder. Believe me, that's not what you want to spend time and money doing. It can cost you thousands. It can cost you a couple of years of your life. We have professional coders that do everything for you. This is a service that you offer to doctors, and they're provided with detailed reports on the codes that are needed for maximum reimbursement. In other words, our coders do the same thing that a coder in a doctor's office would do. That's helping the doctor to maximize the return on those claims that are submitted.
And then AuditGuard is another aspect of where those certified professional coders are actually helping you do some audits, some prelim audits. Think about it. There may be some times where the doctor needs their own codes audited before they're audited by Medicare or any of the other insurance companies.
Yeah, that's because Medicare can charge them up to $10,000 fine for each error in their coding. So, folks, we do have a service here, as you see, that will review all the doctor's charts and identify the possible coding errors. So if they are audited by Medicare, they've already had a report produced that tells them what's wrong, what they should do to correct it. All this is a service that you can offer to doctors, and basically tell them you have certified coders on your staff.
And medical billing is not the only thing that you can do to help increase that doctor's revenue. Obviously, folks, doctors have money that's sitting in accounts receivables, and they need a way to be able to get that. And some of the most difficult things to do is go take care of what you think of as medical collections. And I know that probably all of us have had some bill that come in from a doctor's office and saying, hey, you owe us X amount of dollars, and then some doctors even go as far as turning some patients over to collections. That's not what this is about.
No, you're not in the collection agency business, folks. This is a substitute. It replaces the need for a collection agency. And it's all automated. It's all online, cloud-based. Our systems are all cloud-based. This one allows the doctor to collect that money from the patients that owe him money without making them mad.
Yeah. Without making them mad, and turning those poor patients over to not only the collections, but it ruins their credit. I'm sure everybody's had something like that happen to them. And then choice pay is another way to help with some of those high deductible insurance companies that the patients are faced with, and they need a way to pay that out over time. Choice pay is that solution. Patrick, we're running out of time here, so we're just touching on these just real quickly. So you might want to get back again with the person that invited you to the webinar and go through these in much more detail. But I know that we've got just a couple of these we want to kind of wrap up with. Tell us about what iDocs Now and how that differs from electronic medical records.
Well, the doctors all have records that are in their office on paper, as you can see in that illustration there. Those are some of the files behind the counter in a doctor's office. We can take all of those and scan those into a system that lets the doctor retrieve those documents from anywhere in the world with any device connected to the internet automatically, scanning and searching for any document in any particular way that they want it. It's a HIPAA compliant system of managing their documents, a document management system. So anyway, boy, that didn't tell much about that, did it? Hey, Eric, let's do this. We got 3 or 4 more there. Let's skip all those and talk about it this way. In general, folks, if you'll download the handout that's over in the handout section, these slides have all those details. You can zoom in on them and read them and see what each one of those services are about. We're just running low on time here. So, okay, well, Eric, there it is. We summed up, is 2021 the year to launch a business? I say it is.
Absolutely. And again, folks, we're here to help you, discover yourself whether this is the right timing for you. And Patrick, I'd say, over the last 14, 15 years I've been with you, you and I and the rest of the team, we've always go, gosh, is this the year that it's, this is going to run out for all of us? Not yet. And you've been going strong for 27 years, and I clearly see that it'll surpass 30 years here just quickly. So again, Patrick and I were even talking about this before we even started the webinar today, of how important it is for doctors to still find a biller that's outside of their office.
Yeah, folks, don't continue using an excuse. You can come up with all kinds of excuses as to why you don't do things in life. And one of the big ones is, I don't want to start a business because, and then you have all these different things, that you think are going to hold you back. There's nothing that should be holding you back in this business, in this industry, because healthcare, well, it's just going to be around a long time, and there's a lot of money to be made in it. And besides, we have a 100% money back guarantee. Yes, you can go through our training, all of it, if you want to. And once you're finished with it, just say, you know what, I I don't like this. I don't think this is what I thought it was going to be, and ask for all your money back. That's the only way I sleep at night, Eric, knowing that people can ask for their money back. Now, do some of them do that? Yeah, a few here and there. Less than 0.5%, I guess, in the last few years have asked for any kind of refund, but it's there to make people feel comfortable that they're making the right decision, because it's a big decision to make, I know. Okay, well, folks, if you're wondering if there is a way to get started with us, we leave this sales pitch towards the end of these webinars, because we really don't have anything to sell, do we, Eric? We just have information. We share information with you. We educate you as much as we can, and then say, okay, if you think you want to move forward, then there's basically 5 steps here to take. Look over our downloadable research guide. Now, this is a 50-page guide. It's a PDF, of course, that we'll send to you, but it's information that is not on our website. We want you to have this only if you really have a sincere interest in our business, so you have to ask for it. So ask who your rep is there. You can call that number that you see on the screen, or email us and just say, who's my rep, and tell them I want that downloadable guide. Then number 2, watch our YouTube channel. We have over, what, Eric, 160 now, I think, different webinars that are posted out there. Yeah. A lot of them are interviews with licensees who've been through our training and have shared their success story with other people. So be sure and get that. Number 3, ask your rep for an owner reference list. Now that means a list of people who've actually gone through our training. They did the due diligence you're doing. They purchased the license and they got through the training, and now they're willing to take phone call from you if you'd like to talk to somebody individually besides, somebody here at our office. Then be sure and ask for that live demo of your iClaim EMRX platform, our software. We'll do that one-on-one with you. Just ask your rep to set that up for you. Then next is review the purchase agreement and the funding instructions that we'll send to you if you're really sincerely interested in getting started. And once you've done that, just send that in and schedule your live training. Yeah.
There you go.
You're setting up that training, by the way, with your instructor. And again, it's done online in real time with your instructor turning on their webcam. You turn on yours. You see that little picture there of one of our instructors there. That's Cynthia up in the upper right-hand corner. And she's going through the slides there, answering all your questions one-on-one. There's nobody else in the class but you, unless you invite somebody else.
Absolutely.